everyone to this Fireside chat. Thank you for joining us today. It's a wonderful pleasure to have you all here. My name is Genuine Desire, and I'm a pharmacist and an associate at Supply Health. I'll be your moderator for this session. I am joined by my colleagues from Kenya and Tanzania, who will introduce themselves shortly. For those of you who are new to Supply Health, we are a health advisory firm based in East Africa that designs people-centered, scalable, and sustainable supply chain solutions. Our focus is on optimizing data visibility and use, workforce development, and continuous performance improvement. We currently operate as a social enterprise, aiming for business sustainability while achieving our social mission. Now, in honor of this year's World Pharmacist Day theme of Pharmacy United in Action for a Healthier World, we are holding this Fireside chat that will dig deep into what pharmacists are doing and can do to ensure a healthier world for us all. Today, we'll hear from pharmacists working in various projects under the In-Supply umbrella and the enabling environments that they are helping create for pharmacists in East Africa to provide better care to their patients and their clients. Now, to get us started, I'd like to ask each of our panelists to introduce themselves and tell us a little bit about their role at In-Supply Health. We'll begin with Johnson. Over to you.
Greetings, colleagues. Happy World Pharmacist Day. My name is Dr. Johnson Anyona. I am a pharmacist. I've specialized in health supply chain management. I have previously worked for 5 years in the public sector and currently work for In-Supply Health as a supply chain advisor, where I've been working for the past 3 years. My role at In-Supply currently involves promoting data use for action, building capacity on supply chain, offering regional technical assistance to the Ministry of Health, partners, and other governments in the region in strengthening the supply chain for both the public and the private sector. Thank you for joining us. It's a pleasure to join this panel.
Thank you so much, Johnson. Over to Joyce.
Greetings all. Thank you for joining this session. So my name is Joyce Owola. I'm a pharmaceutical technologist professionally, and I have over 10 years experience working in both the public and private health sector. I have been working with In-Supply as a supply chain analyst for the last 2 years, and in my current position, I support strengthening of the supply chain at the county, sub-county, and community level to ensure that we identify gaps, build capacity, and find solutions while co-creating that with the users. Thank you.
Great, thank you, Joyce. And we'll now move over to our colleagues from Tanzania. We'll begin with Juma.
Hi, colleagues, and thank you, Genuine. Happy Pharmacist Day to you all. My name is Kombola Juma. I am a pharmacist working with In-Supply Health in the capacity of a supply chain advisor, and I'm based in Dar es Salaam, Tanzania. I've been working with the organization for the past 3 years, and generally, I have an experience of more than 12 years working in the supply chain field. I've been supporting the implementation of a number of projects, but mainly focused on improving the supply chain of health products through application of innovative ideas and a culture of using data for informed decision-making. From time to time, I've been imparting healthcare actors and stakeholders with knowledge and skills to understand and use the available data to solve supply chain challenges by following standard problem-solving approaches which are tailored and localized for specific context. Thank you for joining this session.
Great. Thanks, Juma, for that. And finally, we'll go to Happiness. Over to you.
Thank you very much, Genuine. Hi, everyone. Let me introduce myself. I'm Happiness Sabat Beresero. I'm a pharmacist with a master's in epidemiology and biostatistics. I'm currently working as an advisor in Supply Health at the Dar es Salaam office here in Tanzania. I work in the monitoring, evaluation and learning department, and my main role is basically creating an environment in which data and evidence are systematically produced, analyzed, as well as interpreted, and also establishing how knowledge is institutionalized and utilized for program growth. Asante.
Karibu sana. Thank you all for those lovely introductions. And we'll dive into it. A little bit of background for first part of the first part of our discussion. It's important to note that sub-Saharan Africa has the highest fertility rate in the world at 4.7 births per woman. However, sub-Saharan Africa also has the highest unmet need for family planning. As such, family planning has become an essential need for our ever-growing population, and access to a family planning method of choice that is safe, affordable, and acceptable is not just a human need, but a human right. Pharmacists for a very long time have been the most accessible healthcare providers, and they have played a key role in promoting access to family planning services. Recently, the Kenyan government effected a policy change that allowed pharmacists and pharmaceutical technologists to administer injectable contraceptives. Now, InSupply has for a very long time supported initiatives that promote access to family planning, and we are still proud to be supporting pharmacists in this new role through our market test project. We'll now get some more thoughts on this from our Kenyan colleagues. So I'll begin with Joyce. So from your understanding, what exactly is the market test project and what does it intend to achieve? Over to you.
Thank you, Genuine. So the market test project is a project that is aimed at strengthening pharmacy provision of contraceptives in Kenya by expanding access and methods of contraception choice for the women. So the overall goal of the project is to develop and test viability and scalability of a pharmacy business model, which will offer the customers convenient, discreet and quality counseling, training, and provision of contraceptive products, focusing on self-injection, DMPA subcutaneous, within a bundle of other self-care products. And the objective of the project is first to increase the number of women who access quality family planning products and services within the pharmacy channel. Secondly, we are looking at documenting the value propositions for pharmacies to offer DMPS self-injection and other self-care products to our customers. And thirdly, we are looking at expanding the network of pharmacies, implementing viable business models, offering quality counseling, training, and family planning products, including self-injectables, in a larger basket of products. So we are partnering with pharmaceutical associations in Kenya and support with the Ministry of Health. Thank you.
Thanks for that brief explanation, Joyce. And I understand you and Johnson are also working on this project. So the next question goes to Johnson. Could you please expound some more on what exactly InSupply is doing to increase this access at the community level here in Kenya?
Yes, thanks, Genuine. So in Kenya, for many millions of Kenyans, the community pharmacy is the first point of access for healthcare. However, this channel remains greatly underutilized for women to access family planning. So through this market test project, we sought out to first understand what are the barriers affecting pharmacies and clients in accessing family planning through this channel, because to solve a problem, you first have to understand it. So we partnered with our research partners, KEMRI, UCSF, and did formative research to be able to identify these barriers. Secondly, one of the main barriers we unearthed was there was a gap in terms of capacity of the pharmacies who are in service to offer high quality client-centered counseling and family planning services. So in partnership with our association partners, that is Kenya Pharmaceutical Association and Pharmaceutical Society of Kenya, we were able to roll out a series of webinars aimed at creating awareness on FP service provision through the pharmacy, and also building capacity of the members in terms of the knowledge and skills. In addition to that, we were able to support a cohort of about 23 pharm techs and pharmacists to go through a 5-day workshop training aimed at building practical skills on offering comprehensive FP services. Third, we were also able to partner with DKT, who are a main source of family planning products, and detail some of their wide range of FP services, FP products to these services, to these pharmacies, so that the pharmacies can be able to have access to these commodities and offer them in their premises. Finally, we've had a number of initiatives aimed at raising awareness, one to the pharmacies and two to the general public on accessing FP through this channel. So we've been able to support with printing of IC materials such as brochures, FAQs, posters, MEC wheels that the pharmacists can use to support in counseling. We've also partnered with PSK and KPA to raise awareness to the general public through the social media platforms, so that people can know that this is an excellent place to be able to access FP services. Thank you.
Thanks for that in-depth answer, Johnson. I think it speaks to our people-centered approach, and I believe it's truly revolutionary. My hope is that we can scale this up over time to more pharmacies. Great. So switching gears swiftly to our core capability at InSupply, which is strengthening supply chains. So supply chain practitioners across many industries and across the world agree that data visibility for informed decision-making is very crucial for a well-functioning supply chain. Additionally, this data-informed decision-making empowers stakeholders at any level of the health system. So we are talking community, facility, subnational, national, and even at the global level to identify problems and prioritize remedies during regular operations, and even in emergencies, as we have recently experienced in the COVID-19 pandemic. At InSupply, we deeply understand these truisms and we pride ourselves on our impact team's approach. For a deep dive into this area, I'll look to our Tanzania colleagues. So I'll begin with Juma, who will help us in describing what the impact team's approach really is and what exactly are the underlying principles on which it is built. Over to you, Juma.
Thank you, Genuine. Yeah, maybe to begin with, impact is just an English word, which means having a strong effect on something. But in our context, the acronym impact stands for information, mobilized for performance, and continuous transformation. And this transformation is towards attaining supply chain excellence. So impact teams is just a modified quality improvement approach that was adopted to improve data analysis and the use of evidence-based performance monitoring and action planning with the goal of improving supply chain performance. Impact teams are made of people across various functions and disciplines who routinely meet and are trained to develop, interpret, and set targets for key supply chain indicators and use action-oriented dashboards. The team is encouraged to follow a structured problem-solving process, and they are also empowered to use the data for operational and strategic decisions with the ultimate goal of improving the performance of their supply chain. Impact team is built on at least 8 principles, which include principle number 1, having a common goal towards improving supply chain performance and product availability. So that is the first and core principle of impact team. Another principle is to use the available information management systems that provide real-time supply chain data for performance monitoring, but also presence of strong leadership at both the national and subnational level that coach and support teams to overcome complex problems. The teams should also conduct performance monitoring by the use of data to identify problems and monitor progress towards achieving set targets. They should use structured problem-solving approaches to identify root causes and apply local solutions, but also they should do action planning, which tracks the outcomes of the meetings, actions to be taken, and persons responsible, without forgetting recognitions and peer-to-peer learning for motivation of good performance. And the last principle is impact team meeting, which are held regularly, that connect staff from different levels in the supply chain. So in a nutshell, this is what we call impact teams, and I can assure you that this is one of the best approaches towards solving most of the supply chain challenges we are facing. Thank you.
Thanks for that answer, Juma. I think it's a unique and interesting approach to quality improvement in our health systems. Now, I understand that Happiness has a lot of hands-on experience with the impact team's approach, and I'd ask that she kindly explains what ways it has improved decision-making by pharmacists in Tanzania. Over to you, Happiness.
Thank you very much, Genuine. So the impact team approach has equipped pharmacists with the necessary knowledge and skills for extracting, analyzing, and presenting supply chain data that is available from various reporting systems, such as the Electronic Logistic Management Information System, the Vaccine Information Management System, and also the DHIS2 system. So by using the impact team approach, pharmacists have been able to identify supply chain problems. They've been able to prioritize those problems, identify their root causes, and finally develop action plans to resolve the challenges. Furthermore, the knowledge and skills that have been gained through the impact team approach has enabled pharmacists to make informed decisions that have resulted in reduced recurrence of supply chain challenges, as most of the decisions are data-driven and the solutions are tailored and targeted to the root causes. We have also observed efficient utilization of resources due to mainly prioritization of challenges based on the predefined criteria. And also we have seen a culture of data use has enabled improvements in supply chain performance, such as reporting and such as improved reporting and timeliness of data. Thank you very much.
Thanks for that, Happiness. I think the takeaway from me is how much of a paradigm shift the impact team's approach has created. Thank you so much to all the panelists for your very, very apt answers. And even as we close out this session, and again, as the background of this chat that we've just had, I'd like to hear from all of us on our thoughts or reflections on this World Pharmacist Day, on how we think we can create a healthier world as pharmacists and what we'd like to see improve for pharmacists around the world. You can think of this as a parting shot. We'll start with our Tanzania team. Juma, over to you.
Thank you, Jenny. Yeah, I just wanted to say that supply chain is one of the core components in the service delivery process, but it's unfortunately that the cause is not adequately taught in pre-service education. So as a pharmacist, I urge you colleagues who are working in the management of commodities, be a nurse, be a medical practitioner or a lab technologist or a pharmacist, to utilize the online learning packages which are available at InSupply to self-orient themselves on specific skills. By doing so, most of supply challenges will be solved. Commodity availability to our esteemed customers will be guaranteed and well managed. I wish you all a happy World Pharmacist Day, and remember, no commodities, no program. Thank you.
Thanks for that, Juma. Over to you, Happiness.
Thank you, Genuine. I would like to wish all the pharmacists a happy Pharmacy Day, and I applaud them for their great work and dedication to serving the Tanzanian population. Thank you very much.
Great. Thanks, Happiness. And now we move to the Kenyan team. We'll begin with Joyce and then Johnson. Over to you, Joyce.
Thanks, Jenny. So just to add on to what my colleagues have said, as pharmacy personnel, we need to develop strategic efforts towards strengthening the supply chain. This will ensure provision of quality, affordable, accessible healthcare products and services to enable us achieve the universal health coverage for a healthier world. We should remember no commodities, no quality healthcare. Thank you. Have a wonderful and happy Pharmacist Day.
Amazing. Over to you, Johnson.
Thanks. So for me, I'd like to urge all of my colleagues that as we mark this year's World Pharmacist Day, that we all strive to apply our knowledge experience, expertise to the best of our ability, and continuously acquire new skills, new thinking to address the modern day challenges that affect the health of our communities. Happy World Pharmacist colleagues.
Awesome, amazing. Thank you, thank you, thank you so much to our panelists. I would like to extend a huge thank you to all of you and for your time. I think it has been such a rich discussion despite its brevity, and your insights have really helped to demonstrate how pharmacists can help create a healthier world. To our viewers, we hope you've all enjoyed the discussion today, and may we continue in our pursuit to provide life-saving medicines to all our clients and our patients. We at InSupply Health wish you all a happy World Pharmacist Day. Thank you and bye-bye.